Hi everyone, my name is Syed Mudabirzadi and welcome to the Imaging Experts of Pakistan. Today we are going to discuss about possible horizon in radiology and scope in research as a radiographer. We have got our honorable guest here, Mr. Muhammad AbuZaid. Assalamu alaikum.
Alaikum assalam wa rahmatullah.
As an introduction, I would say Dr. Muhammad AbuZaid is an assistant professor at the Department of Medical Diagnostic Imaging, the University of Sharjah. We would like to hear from you if you give our listener your brief introduction, please.
Okay, thank you very much. And thank you for giving me these opportunities to speak to our colleagues in Pakistan. It's my pleasure, and I hope that they will have some benefits and knowledge from what we are going to discuss today. Basically, I'm a radiographer, and I graduated from Sudan University of Science and Technology in 1994. And currently I'm working as assistant professor at the University of Sharjah at Sharjah Emirates in United Arab Emirates since 2007. I have a clinical experience. I have also teaching experience. So my main interest is working on the radiographer development, and I have many research areas. That's in short. Thank you.
Yeah, thank you so much for joining us. We will start our program now with the first question, like, what is the radiographer role extension?
Let's start by defining the role extension. The role extension is the thinking outside the routine or the current role of the radiographer. We know all that the radiographer main task is to produce and high quality images from the anatomy and the physiology to demonstrate the pathology using various equipment, general X-rays, computed tomography, MRI, ultrasound, nuclear medicine. The role extension, it's beyond producing the image. Especially the idea of role extension, it comes especially after the development of the digital imaging. And it's also developed after, in some countries, they realize that the radiographer can help in some areas more than just producing the image. And the idea of the role extension started basically and first at UK, when they realized that the radiographer can help in doing some image interpretation. And it developed and transferred to different countries in Europe, in Australia, in US. And we hope that in our region, in the Middle East and this area of Asia, that the radiographer role extension will be developed soon. It needs a hard work, and it needs a very well established study to start something like this. The job description of the radiographer in the old days, it had some aspects like image processing and image sortings, and these responsibilities changes with the digital imaging, like the PACS and the radiology information system and the digital images. And the quality of the image, it improved a lot, in addition to the facilities that the computer added to the image itself. And it will become more easy for the knowledgeable radiographer, the one who had enough knowledge and enough experience, to say something beyond this image is good or bad.
Yeah. So, what are the tasks that radiographer can do in role extension?
Okay. See, the task, it should be developed, in my opinion, it should be developed according to the need of the place and according to the need of the country. For example, we know that the number of radiologists in many countries, even in our region here in the Gulf area or in the Middle East, in Sudan or in Egypt or in these countries, the number of radiologists who are able to provide image diagnosis or image report is very low. And in many places, there is an X-ray machine or medical imaging technology with a radiographer, and the image is not either it's not reported, or it's reported by the physician themselves, or sometimes the radiographer he give his opinion informally or beyond his job description, and this is it can be considered as a deficiency in the healthcare quality, because it's not enough just to produce an image and give this image to the patient or to the physician, but we need to make sure that we give this image and we give them the image interpretation. Yes, the digital imaging and the PACS, we can say that we can send the images remotely and we can get the diagnosis, but still it takes time and it needs strong infrastructure in terms of communication, in terms of connection, in terms of internet. And in our region, especially as I said, in some countries like Pakistan, India, Sudan, in the Middle East, this infrastructure is not available. So number one, the radiographer can help in giving their opinion about the presence of the pathology. I don't want to use from the beginning the word image interpretation, because image interpretation need a strong base. So we can start by giving some image commenting, or we can start by giving the basic of the image interpretation, like highlighting the pathology area. And this will help the physicians to get a fast report and a fast, accurate diagnosis to the patient. In addition to the image interpretation or image commenting, we can define many things, like the PACS administrators. If we are in a place and this place is equipped with PACS and digital imaging, the PACS administrator is one of the role extension of the radiographer. Radiation safety officers, it's one of the role extension for the radiographers. The radiographers who are responsible about quality control and quality assurance in the department, which is related to the patient safety, to the department management, to the workflow. This is also can be considered as role extension. In addition to some tasks like contrast injection, for example, insertion of the cannula, doing some special procedure like the barium studies or the IVU studies. These are all can be defined as a role extension.
How the role extension supports the radiographer in his career progression.
Okay. See, when we go back to the history, we found that the radiographer education started by diploma, 6 months diploma, then 1 year diploma, 2 years diploma. But always the radiographer, they don't feel satisfied. So they reach to 3 years diploma, then 4-year bachelor degree. And now there is many universities offering a master degree for radiographers. And there is some universities also offering a PhD for the radiographers. So there is 100%, there is an academic development of the radiographers. This academic development is not accompanied with career development. In many cases, the radiographer who is equipped with diploma 2 years or 3 years is doing the same job with the radiographer who is graduating with 4-year degree. The career progression and the career development is not matching the qualification. This is lead to reduce the job satisfaction, and it reduces the ability of the radiographers to develop in their career. So it turned out that they graduating with 4 years bachelor degree, and some of them they have a master degree, but they ended by doing the same job. and even in terms of ranking or department progress, they do the same job. So this is bad, to be honest. And in the future, it will be one of the big threat to the career. We want always to attract the good generation, the good high school students to join the profession. If we don't have clear pathway to our job, to our professions, we will not do that. We will not attract these good students. And also, we will find out that the retention rate of the radiographer is very high. That means they will not continue in the job with the same enthusiasm, with the same ability, with the same. They will end it by doing the job without the feeling, and this is very bad to the profession. The role extension is the right step for the radiographers to accompany their knowledge and their degrees with the new task or the new role that they can do it in their practice. And at the end, we are not competing with someone. We are not competing with the radiologist to take some of their part. We are helping the patient in the area where there is no radiologist. Also, at the same time, we are providing, for example, if we talk about image commenting, we are providing a fast commenting on the image when the radiologist is not there. In addition to that, even the radiologist role is developed. You know, there is many images modalities, and it needs the radiologist to be concentrated in more than just diagnosis or reporting a general X-ray or musculoskeletal images or chest X-ray. They can concentrate on the advanced imaging modalities like the MRI, perfusions, CT scan, nuclear medicine. So it's the right step to improve the progress of the profession.
Yeah, that's very important as well. Do you think that the role extension can consider a threat to the other profession, like being a reporting radiographer or the tax administrator?
See, this is what I just said before. We need to understand that we are working in a team, and this team is has one goal, which is providing the accurate, the fast, and the proper health care to the patient. And as I said, the role extension is not only image interpretation. When the informatics integrated in the department, there is some people, they came to the department, like the IT people and the fax administrator, who are at the beginning, most of them, they are IT background. We didn't think that these people, they are coming to take our jobs. Even though now there is many radiographers working as a fax administrator, but there is a collaborations. Also, there is something very important, which is a medical physicist. The medical physicist is a very important personnel in the imaging department. And we don't think at any means that they are threatening our jobs by doing image evaluation or image analysis or something like this. Let's talk about sonographers. Okay, the sonographers, when it started, the idea of the sonographers, it was a threat to the radiologists because they took their part of their job. But later on, even the radiologists, they thought that, or they recognized the importance of sonographers in the department, because, you know, sonography extended in all direction, in musculoskeletal, in the respiratory system. It's very important. And then we found that many medically specialization, they are doing sonography by themselves, like the obs and gynae doctors or the surgeons or the urologists. They do the ultrasound by themselves. And we ended by that the sonographers, they are not threatening anyone in the department. So again, it's not about threatening the jobs. It's about improving the quality of the service and providing an accurate, fast image to the patient when the radiologist is not available in the area or when the radiologist is not available at that time. So this is about the idea about the role extension.
So what do you think we need to develop to improve our radiography job for the future or the present?
There is three elements actually. Number one, we need to work with the educational institutes, the universities and the colleges responsible of graduating the radiographers. Number one, they need to think carefully about their curriculums and to find out how they will develop this curriculum to match the role extension. This is very hard job because now in many universities, in many colleges, the people or the instructors or the faculty member responsible about radiographer education is not 100% radiographers. For example, when you go to the medical college, you will find 100% of the medical college is graduated from the medical college. But when you come to the imaging department or the medical diagnostic imaging department, you will find different specialization. This is acceptable and this is required because our major is having the medical aspects. We need anatomy, physiology, pathology. We need someone from the physics to teach the radiation physics and the medical physics. We need someone from the radiography to teach the positioning and the image quality. We need a radiologist to teach us the image interpretation and this kind of knowledge. We need someone from the IP to teach us the facts. And so all these specialization, they need to work together to build a curriculum that are able to graduate the radiographer with role extension skills. This is number one. Number two, we need to define the needs. And to define the needs, this is also another huge work between the health care providers, for example, the Ministry of Health or the private hospitals in different countries. And these healthcare providers, they need to define the deficiency and the needs of role extension for the radiographers. And then later on, they need to define a proper job descriptions, a proper ranking, a proper career path for the radiographers with diploma 3 years, 4 years, bachelor degree, master degree in different specialization. And number three, we need strong societies, academic and professional societies. And unfortunately, the societies we have it in our region, the concept is not clear. Some of them, they are academic societies or scientific societies. Some of them, unfortunately, they are politic societies. Some of them is just organizational societies. So we need a proper society, professional body to be responsible about the profession itself. Last, we need the radiographer themselves to appreciate their job, appreciate their knowledge, their skills, their degree, and look forward for the future. Yeah.
Perfect. So what is the role of an organizational body in radiography practice?
First of all, they need to defend the radiographer, and they need to make sure that the radiographer, they have a clear organization in terms of job description, in terms of career pathway, in terms of development. They should be able to help the conference, the scientific meetings, they should be able to look behind the radiographer needs and build the connection between the universities, between the radiographer and the stakeholders, like, for example, as I said, the Ministry of Health. And we hope that the societies also will work on the development of research. If you notice, the College of Radiographer in UK and EFRS in Europe, they are working hard now. Not now, they are working hard since maybe the last 20 years to build the research concept on the radiographer work practice. And this is one of the deficiencies that the radiographer.
Yeah, you're absolutely right that we are very far behind as compared to the societies in UK or in America.
Yeah, research is very important.
Definitely.
Yes. Again, the university or the academic institute are responsible of building the research basics for the undergraduates. And after the postgraduates also, they are responsible of building this concept. But I always say that the radiographers has many opportunities in research, but we missed it by many reasons. For example, if we look to the research related to the case studies, we found that many journals published radiology case studies. And this, the author of these cases is usually either radiologist or radiologist and physicians. No one think about the person who produced these images. And even the radiographers, they don't recognize their role in publishing some or participating in publishing some case studies. Especially now, if we talk about the sonographers, they are the person who make the images, and they have the enough knowledge to write the reports. So they should have the ability to write. And this is one of the jobs of the society. The society should work on building the skills of writing, skills of research ethics, for example, how to take ethical approval, how to write a research, how to publish a research, and they should provide support on that. There is many research websites. When you go, you don't find any radiographers. For example, the researchgate.com. Rarely you will find a radiographer registered in this website. We, in University of Sharjah, we always ask our students to have their account in the ResearchGate account, and even to start publishing some of their basic works, like the research poster, for example. When the students feel that his name is published and it's somewhere in the research media, he will have some motivation to continue in the future. So this is one of the easy opportunities that the radiographer is always missed by many reasons.
If you want to tell our listeners about the scope of a radiographer in the research, how would you explain that? What is the scope of a radiographer in the research field?
See, myself, it was a very challenge for me. During my master's degree and while I'm during my PhD, it was a challenge. Even after my PhD, it was a challenge because you need to compete. If you want to do a research in radiation measurement, radiation protection, you will be competing with the medical physicist people, and they are more knowledgeable than us. If you want to do a medical research, you will be competing with the radiologist and the medical specialized. If you want to do the educational research, then you will be competing with. So it's a challenge. But at the end, the radiographer should define his scope. If you want to work in radiation, so he need to concentrate on that, and he need to start step by step. The first steps is very hard. Then after that, after you have your knowledge, your skills, and you build your connections, then you will find it easy to go forward in your research area. Even this area of role extension, if you look to the Radiography Journal, which is supported by College of Radiographers in UK, they are publishing many articles until today about the role extension. Not only in UK, they are publishing the role extension all over the world. We published it from UAE, from Middle East, from Africa. So the scope of research area, it depends on the radiographer himself. Of course, he needs the support by universities and by some research groups. And this research group can be developed by the senior radiographer or the high qualified radiographers in the hospitals or in the universities to build some research group, and everyone will work together. And this definitely will help to improve the radiographer scope of research.
Well, thank you so much for your time, and it's an honor for us that to have you at our platform. And definitely, we have discussed a lot of things today, and this is going to benefit all the radiographers.
Thank you.
Thank you so much.